Well, we'll call the meeting to order. We'll start with the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we have an agenda before us. Is there any additions or corrections? If not, is there a motion to approve the agenda?
Looks complete to me. I move to approve the agenda as submitted.
Motion's been made. Is there a second?
I'll second.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Okay, approval of previous minutes, board meeting November 5th. Everybody's had a chance to look at those. Is there any additions or corrections to the board minutes on November 5th? If not, is there a motion to approve?
Motion to approve.
Is there a second?
I'll second it.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Work group session minutes from November 12th. Everybody had a chance to look at those. Are there any additions, corrections to those? If not, is there a motion to approve?
So moved.
Is there a second?
Second.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Public comment.
We don't have it up there anymore.
Public comment. Appointments, closed session, we'll have that towards the end of the meeting. Probably after the, action item number 11. If that's okay with everybody.
Sure.
All right. Moving on to the consent agenda. There's 4 items on the consent agenda. Any questions on those?
Just a question with regard to number 2. Have we already advertised for his replacement?
No. Not that I know of.
Not to,
Okay. Oh, that's all.
Any other questions? Is there a motion to approve the consent agenda?
so moved.
Is there a second?
I'll second.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Moving on to action items. Number 1, consider accepting Brownsville VFW Auxiliary Post 6801 donation of $100 to the Veteran Services Office to use as any veterans needs. Something we do quite regular.
That's an easy one. I'll move for that one.
Is there a second to that?
Second that.
Bob seconds that. Schultz?
Sure, take the easy ones.
Any further discussion? Not all those in favor signify by saying aye.
Aye.
Opposed, same sign. Number 2, consider approving quote from ES and S for the purchase of 15 Express Vote Universal Voting System terminals in the amount of $52,700. Polly.
Hey, good morning. Last week, we had 2 demonstrations from 2 different groups regarding election equipment that we were going to be replacing. It was Trish from ES&S and Bruce and Larry from Command Central. As I left last week, I was under the assumption that it was the intent of the board to move ahead with ES&S. Some of the reasons that I picked out that I was hearing that day was it's smaller, it's lighter, it's more user-friendly. It's a universal machine, not just an ADA, but a handicapped machine. And it is already compatible with our DS200s. So it appeared to be a good fit. So with that in mind, we I did go ahead and put it on the agenda, although there was a slight change after that. Mike Werner, who was so gracious to come in and test those machines for us, did come up with some other ideas for us, just suggestions to keep in mind. One of them was to purchase 14 instead of 15 and have the backup machine be the county machine. Kind of makes sense, and we could make that work after we were thinking it through. So in a sense, even though we have already budgeted the full amount in the spreadsheet that I gave you last week, I did calculate a little bit more of a savings of $3,210 right off the top if we choose to go with the 14 instead of the 15 of the ES&S Express votes. I'll just quick hand these out if you want to take a quick peek. But the new one is on top and the one from last week is underneath.
Thank you.
Thank you.
Which it shouldn't be a problem because there's no voting at the county that day.
Right, when we finish up per se, we could make that available.
Right.
We could have it programmed, ready to
There's
go
one that
for,
goes down at another polling place. That'll be available to,
correct, to ship out and get it there if need be, so. Someone else last week too had mentioned that I reach out to see how often the regular AutoMark is used. So I just took a kind of an unofficial survey and I heard back from 21 of the 27 precincts. And there was only a handful that have used them. Some of the judges use them just to try them and keep them working so they understand how they work. But as far as true voters, there was maybe 3 altogether that used it from, that was just the strictly AutoMark, the ADA part.
it's a moot point because it doesn't matter how often they get used, they
Have to
they
have
have to
them.
be available, so. No matter what, even if it gets used one time, so.
So these 14 machines then, is one for each each
Polling
voting
place.
place. And the one from the county would be the 15th to spare.
Nope, that would be our 14th. So there's 13 polling places plus the county, which would make 14.
But there's no voting at the county the day of the election. So it would be free to use at another polling place if need be.
We talked about buying 15. Now we're not gonna buy 15, we're gonna buy 14.
We could get by with
This
buying.
one makes, the one that we have makes the 15th. So that's the spare.
The county's is the spare. It's one and the
15th.
same.
The
We're gonna have a spare besides the one that the county had.
If we bought 15, then we'd have 2 spares. The 15th one that we buy plus the one at the
If
county.
you wanna look at that way, yeah.
Yeah. So now we're gonna have one for each, and then that heavier county one is the spare that we would have to haul to a precinct if.
Correct,
Or
If they
polling
need it.
place if we needed it.
if they needed it.
Now, this operation does not have, do they all 14 come with the handicap
Yes,
dealie? Okay. Okay.
So if we were to do this, to go to the 14 instead of the 15, the new outright cost to the county after voter fund distribution.
yes, because we'd have some grant funds available that are shown on the
Phase
spreadsheet.
1 grant, yeah, so it'd be 19,000, is that correct?
Yes,
19,782.94
correct.
instead of the original of 22,992.94.
Correct.
After that demonstration last week, I lean towards the express vote too, because it's compatible to our DS 200s that we already use. And it looks like it's easy to use. It's a lot lighter. I like the card where you can pull it out and look at it and
Didn't seem as quite as difficult to operate either. It
It
seemed
was very
each
simple.
smaller device.
And actually going back to Mike's suggestion, Mike Werner, that was one thing that was very, very important to him, was to be able to put that card in and be read back that
To what he voted,
Was he-
to make sure it's right.
exactly.
And if it's not right, then he could ask for another ballot, and it'd be a
Spoil it.
spoiled ballot. He can't change the vote, but he can
Right.
request another ballot for us and make it a spoiled ballot. Yep.
And then if you went with the other company, then you'd have to buy the DS 200s too, or sell ours.
Yeah. Well, what do you guys think? What do you, on that proposal of changing it to 14 versus 15?
I can agree with that. If we don't need the extra one, the 15th one, and I think we all agree that the ES and S program is easier to work with, so I go with that. I'll make that motion to purchase 14
Express.
universal voting terminals.
Motion's been made. Is there a second to that?
I agree with all the reasons for doing this, so I'll make it a second.
Should be noted then the total cost would be before grants is 49,490, correct?
Would be 50.
Instead of 52,700.
It'd be 51,240. The very top line on the new
Oh,
spreadsheet.
sorry.
And that again would take a little bit off of our maintenance costs at the bottom there too, of course, each year, so.
Well, I'm just going by what's on the agenda here, Polly. It says 52,700.
Right.
So it's
On our
It's actually 49,490
it is because I've added in the
case.
implementation services and
Yep.
installation, and
Yep.
that all came to the 52,700, which matched her quote,
Okay.
so. Of the machines themselves, or,
I think for
Kinda hard to-
I think just for clarity, because it's on the agenda at 52,700, it should be 49,490.
okay, I'll agree with that, the way I
Okay.
have it, yep.
Everybody understand that?
Yep.
Mm-hmm.
Okay, we've had a second. Any further discussion?
No, sir.
If not, is all those in favor signify by saying aye.
Aye.
Opposed, same sign.
Thank you.
Thank you. All right, number 3, consider approving contract renewal for E91 service support agreement with Vesta Solutions. Brian.
Morning, Commissioners. This is a renewal contract with Motorola 911 Vesta. They originally wanted quite a bit increase for the contract. We were able to negotiate them down, or talk to them and negotiate down another $5,000, excuse me, $5,670 off that. This is a large increase, but we were able to get it dropped down somewhat. This system with the whole state also has affected all the counties. Talking to other sheriffs, they also got a very large increase their contract. Everything comes out of the 911 money for this contract.
Which would cover it, right?
Yes,
So you're saying you negotiated 5,000 more than what you got here?
$5,000 off. It was originally
98,400, or am I looking?
98,650 or 670, excuse me. And then we negotiated 5,670 off, which came to the total of
Okay,
93,000.
I see that. Okay, yep, 5670, which goes to 93,000. All right. And what was it before?
Like, talking right now, they wanted originally.
No. You said it's a substantial increase from
I believe it
before.
went up, I don't have the exact number, I believe it went up about 10%. It was like 89, I believe.
Okay.
It's all paid for out of the E911.
Correct.
It's not a levy item.
No, that's correct. And we did look at other,
Gotta have it.
we gotta have, and we looked at other companies and it was a very large difference.
This is a continuation of current service.
Correct.
This is going good, working good, everything's,
Absolutely it is. Most cost-effective way also. Otherwise, other companies want us to buy products, and which would be hundreds of thousands of dollars to buy the product.
All that said, I'll make a motion to approve
Motion's been made, go ahead.
the E91 service support agreement with Vesta Solutions.
Motion's been made, is there a second?
I'll second it.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Okay. Action item number 4, consider approving contract with Hennepin County to house Hennepin County inmates.
Hennepin County Sheriff reached out, Sheriff Witt reached out, looking for, housing for their inmates. They're looking to house out between 200 to 300 inmates
Around the state, yeah.
around throughout the state, for several months. I believe it's 3 or 4 months. I did advise them that with our low population in the jail, that we would be able to house their inmates. I told them it'd be up to 30 inmates that we'd be able to house with our current staffing. The pricing, I did advise it would be $100 a day. And I believe it's not technically specified in the contract, I don't believe.
Yeah, I was gonna ask, cause it's not in here, that says it's $100 a day.
Correct. I think this, I believe this is their generic contract they sent out to everybody, so don't gotta make everything different.
So this is a contract they sent out?
Yes,
Oh.
this is their contract.
Sam's okay with it?
Yes, the county attorney looked it over and he was fine with it.
So shouldn't it say $100 a day in there? I mean, I mean, you got
I
a
just
maximum,
went,
you got a,
I gave it to the county attorney, he said it was fine.
yeah. You got a maximum of 611,000, right?
Yes, that was over time period also, was it 2 years or something?
Oh, is that the deal?
Yes, I don't have had to look through the contract here and says how many years it's over, that their maximum payment would be.
$610,000 is, shall not exceed.
Correct.
Yes. I thought there was a year limit though too.
Well, yeah, okay, so if it's $100 a day, if you get 30 inmates, that's gonna,
30 inmates is roughly $90,000 a month. And I believe, like I said, I believe they said 3 or 4 months they're looking at.
and then then they'll have to do something different, or?
I'm assuming so. They didn't tell me what their plan was.
Well, this stems from their order from DOR or DOC
DOC.
to,
Correct?
lower their jail population.
Yeah, I guess I can correct their issue.
Yeah, they were recently sued and lost, and
Correct. They did advise, we did talk to them about their inmates. They advised that since we are quite a ways away, they would be giving their pre-sentence minimum secure inmates that aren't a problem, aren't on a large amount of medication. So we wouldn't have any issues because they don't want to come down here 2.5 hours to get their inmate that's a problem or we have issues with.
Your staffing is adequate to handle this many?
Correct. The only thing we worked on and we got basically worked out is the meals. Right now, we use the frozen meals from Cellmate.
they were only contracted for, what, a minimum of 15 or something?
Yeah, we can order as much as we want.
Okay,
We actually order it through Cisco services, and then Cellmate works the pricing out with Cisco and they bill us. So we can order as much as we want. But I'm looking to possibly do it a different avenue service.
you just haven't gotten that far yet.
We're either gonna do it in-house, through Cisco, or I did talk to Elsie's, they do the Meals on Wheels. Use that service. LCs, not the Meals on Wheels, but,
Yeah.
or also talk to, Earmark and Lacrosse, who also does, Lacrosse County's meals. And they just talked to him the other day. He's gonna get back to me on, what he can do for us.
So the length of this initial contract would be not to exceed 4 months, possibly? They're looking at 3 to 4 months, but
I believe, like I said, the contract, I thought the contract said the dollar amount up to a couple of years. But, I mean, it's our discretion.
and as you know, sometimes the folks from up there have different way of being incarcerated. Are we able to handle the less than ideal individuals?
Well, that's what, when we talked to them, they said they were gonna give us our version of ideal inmates. Cause they don't wanna, if we have issues with them, we're gonna tell them to come and get them, and they don't want that.
That's the point.
Our staff is fully trained and equipped, so.
Yes. Right now, like I said, we have a low population and, today we don't have any juveniles in our facility either.
How many inmates do you have right now?
Oh, I didn't look today. 2, I believe, 3?
But we're staffed to handle 30.
Correct.
That's with the 8 juvenile spots if they were to be used?
Yes. Yes, we can do all of that. We told the Hennepin County also, like, we only want male inmates. Wouldn't be able to do male, female, then plus the juveniles. We don't have enough pods available.
Oh, okay, yeah.
Good.
So how much did you figure this is a 3-month contract?
3 to 4 months.
I don't see where there's a month period here.
No, it's
Just
just,
a maximum of 610,000. I don't see it.
first page, terms and overview. November 1st, 2024 to December 31st, 2026, unless terminated.
Right, okay, yep. November 1st, 2024, or to the end of 2 years from now, 26,
Roughly. That'd be the contract,
but not to exceed 610,000.
correct. So, for example, if they, in 1 year, they have the same predicament, we could still use the same contract.
But we're figuring, what do you got it figured at?
$100.
$100 per person
How
per
long-
day.
How long are we really anticipating?
I'm anticipating 4 months.
Okay.
And remind me, how many, are you looking at 15?
Up to 30.
Up to 30, but you have now the 30 includes the juvies and our own guests.
We're allowed to house up to 40.
Okay,
So I told them 30, plus if we had 8 juveniles, we still are under that 40.
So if we get an inmate that's getting to the end of their sentencing, they will be hauled back?
They transport them both ways. If they have any in-person court, they haul.
They're not gonna be released here, they're gonna be.
No, they're not. They will not see, excuse my Freshman, outside daylight in Caledonia.
Well, that's gonna be a question from the public, is it?
Yeah, they're gonna be transported to the Sally Port, brought into the detention center, and brought back to Sally Port and transferred back up to Hennepin County.
So for 4 months, it's $360,000.
Roughly.
There's,
Maximum
Everyone-
also, I should say.
how is it that, like the juvie, how much are we charging a day for juvies? $250?
Contract 250, non-contract 300.
How come this is only 100?
Adults are a lot, lower priced. Last Winona contract, I believe, was at $65 a day,
5 or 70,
somewhere right in there.
I'm glad you've raised that
Yes.
to 100, because meals have gone.
I did tell them 100, then we talked a little bit, and they said their average varied between 60 to 120. So I'm on the high end.
we're in the
but-
middle, or low,
Did you talk them into a juvenile contract?
So you want to go down that road, so, Mower County, is gonna sign the contract, Goodhue County Board approved the contract. Olmsted County's coming down, beginning of December to do a walkthrough. They advise that that's what they do pre-contracts. So we're looking at for sure.
I suppose, I'm sure Hennepin County has a facility that they, for our juvenile.
What was that?
Hennepin County has their own probably?
Yes, I'm assuming so.
So if the state of Minnesota gave Hennepin County an extension, and this just backs up,
Then it'll be our discretion, no matter
no,
what.
I mean, if Hennepin County got an extension of 3 months or whatever,
Correct?
they don't have to ship out the 30 prisoners because of the extension?
I guess, I don't know that,
You had sent me on the,
I don't know they're between them and the DOC, I guess. I don't know what they have agreed on or what they've been told.
Oh, you're talking about the MACA news?
yeah. Talked about Hennepin County getting an extension from the DOC.
I think they're on the extension already. They're scrambling to find places to put these people.
Okay.
Yeah, that's what I'm assuming.
Houston County, before we built the jail, we're getting extension after
Right,
extension.
and like, I think Winona County had the same kind of thing too. Extensions.
All right.
But do we want to put a sunset on the first one and then look at it again in 4 months if we say something like that, or?
I have no problem if you want to give it, once they come here and you want to give it 2 months and come back and have a discussion about it. And see how it's going, and you guys can hear firsthand, I guess.
Well, by the time you get it going, it's gonna be the first of the year, so.
But I think they're looking at next week or the week after. Yeah,
As soon as the ink is dry.
because they wanted to do it last week.
Is there a clause that you can get out?
Change what?
Is there a clause in here that you can get out of the contract?
30-day notice, isn't there?
Also.
Is that what it, okay.
Either side, 30 days.
Where does it say that?
Cancellation. Ooh, wait a minute. Agreement may be canceled by either party at any time with or without cause upon 24-hour notice,
Written note, yeah.
written notice.
Ooh.
Yeah, so they have to have 24-hour, notice, and then 72 hours to remove their inmates. That's pretty close, the same as language as Winona had too, I believe,
Yeah.
for inmates themselves. So I guess realistically, if you want to cancel the contract, we can tell them we don't want all the inmates in the 72 hours.
Yeah, I don't see a 30-day here, so.
That payment is a 30-day above it there, that's why.
Yeah, the payment's 30 days, which is normal.
I would want the $100 a day in there somewhere. I don't know, can you make approve this, we can make that with that.
Yeah, can you approve it
Yep.
with the,
With
Stipulation.
the stipulation that the $100 a day figure is in there.
hey, that'd be wonderful.
That way you can have them here next week if you want.
Yes.
Parade of Hennepin County squad cars coming down.
I'm
Oh,
sure
I
that-
bet they got a bus.
Yeah,
here.
they got vans or a bus or something, I'm sure.
Be a couple squads, one in front, one back.
And I guess I haven't really discussed with them, if we're gonna do this in chunks, bringing somebody down at a time. That'd be more ideal for us.
And you've been talking with your jail administrator about this?
Yeah, we've talked a lot about it. We're gonna put all of the, Hennepin County inmates, I call it our Huber dorm, which will hold all of them.
We need a motion?
Well,
Yep.
and you think you can handle up to 30?
Yes,
For that?
I mean, if we can't handle 30, we can do 10, we can do 5, I mean, whatever.
We're staffed to handle 40 inmates.
Yes, we're staffed to handle 40.
Oh, we don't have to hire no extra staffing. I'll make a motion to accept the contract with Hennepin County.
With the stipulation of $100 a day
Is
added to the contract.
added to the contract.
Is there a second to that?
second it.
Any further discussion? Dewey, you wanna say something?
No, I was just thinking, but yeah, I don't know if we wanna put a limit on the number, but I think the sheriff makes that decision, so. That's the only thought I had.
Okay, all those in favor signify by saying aye.
All right,
Opposed, same sign. There you go.
Thank you.
good luck with them.
Order up.
I'll keep you updated.
That'd be good.
Yep.
Thank you.
You're welcome.
Action item number 5, consider approving a resolution 2442, final acceptance for the contract with Dunn Blacktopping for the paving of County 13. Brian.
Morning, Commissioners.
Good morning.
Yeah, so this is the paving of County 13 that was done this last summer. Work was completed, we have all the paperwork, so we're ready to close this project out. So original contract was $3,674,929.99. The work's certified $3,497,226.92. So the final work was about 95% of the original contract amount. So this will close the project out and we can issue the final 5% retainage.
Project turned out pretty good. I'll make a motion to approve.
Is there a second?
So move.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Action item number 6, consider approving resolution 2443 for the final acceptance for the contract with Zinke Construction for bridge removal on Haugie Hill Road. Now, we're just the fiscal agent for that, correct?
Yep, so this is similar to a town bridge project, except instead of being a town bridge, it is a road in lieu is what they call it when they remove the bridge and do the earthwork and get everything shaped up, so, but yeah, the township is responsible for the local costs. So the original contract was $64,418.76. Work certified $74,512.26, so about $10,000 over the original contract. That is primarily due to extra rock and a little bit of vegetation removal that was needed for the project. And being that this is a bridge removal, actually the local cost of the township, half of that gets picked up by the state, so the Sheldon Township's responsibility is greatly reduced compared to if it was a bridge replacement project, so. But the project was completed in the second half of the summer, and we're ready to get this closed out.
The $10,000 overrun was covered by the state, not the township.
Yes.
Is there a motion to approve the final acceptance?
I'll make a motion to approve the final acceptance.
Second,
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign.
Thank you.
Thanks, Brent.
Thanks, Brian. Number 7, consider adding 1 FT RN PHN and a 1 FT community health worker for public health division. This is something we're looking at again after we've gotten more information. Appreciate that.
Correct.
So do you wanna go through it all again, or?
If you, I'll follow your lead. What we did was, just a second here. So we sent you several things. We sent you the staffing analysis and recommendation from the consultant we're working with for strategic planning. We also sent you job descriptions and banding for the track nurse position and also the community health worker. Let me back up. We didn't send a banding for the nurse position because that didn't change. So, also sent you a number of different statutory references to give you a sense of where the responsibilities that are coming to us, new responsibilities are coming to us, where they're coming from in statute and where the money is. And then also sent a summary of major public health funding to you to give you a sense of not just the new funding, but also kind of where that lands. Bottom line, it all hangs on state statute 145A. That's what governs local public health. It's also incidentally the statute that you may choose to use with regard to establishing a cannabis ordinance locally. So that's all part of that large public health, local public health statute of 145A. So one thing I'd say about the funding sources that I didn't say at the last meeting, we talk about grants, and it's interesting because typically, I mean, we get some grants from the state for human services, but a lot of times we talk about formula funding and allocations. Really, in the world of public health, they call them grants, but they're allocations. They don't operate like a grant. It's not something that is competitively applied for and time limited. Essentially, it's driven by statute that decides how they're going to allocate resources to local public health entities. So just to draw that distinction, when we're talking about a grant, especially in this situation, it's really think it more in terms of an allocation from the Minnesota Department of Health. So
This, when we talked about this in the past, you said this was a rolling grant that you can
correct.
take the money that hasn't been used this year, roll it to next year, and then use it as far as hiring the 2 employees and then roll excess to the next year and the next year. And it's a 4-year program.
Total of 5 years, but we're just
1 year's
about
already
done.
gone, so there's 4 years left.
Right.
So that's the way this is.
Correct.
So if we were to approve this, can we approve it on the basis that this doesn't have any effect on the levy because the grant covers this for the next 4 years with that rolling program? And if the grant or the funding is lost, the staffing is lost as well?
Yeah, I think so. One thing I'd note as well, you know, I understand caution with new funding, and I appreciate that, and I share it. But it isn't an uncommon thing. There's changes every year, and we navigate those changes as we develop a budget or as we consider how we're going to staff things up to meet requirements. This is no different. What they've said is with these 2 major funding sources, Foundational Public Health and Response Sustainability Grant, we can carry those over for the first 5 years. As you mentioned, Commissioner Burns, we're just about done with year 1 and have spent virtually nothing. So that gives us a sense that at least in the first several years of this, we'll be able to carry those dollars forward. And that will more than cover the cost of these positions. We've also done an analysis since our preliminary budget. So if you recall, we put together a preliminary budget in the summer and end of the summer, and we had these positions as well as the revenue below the line because you hadn't approved the positions. At that time, we were projecting a potential of $27,000 additional in levy needed just not knowing that we would be able to carry over dollars and not considering third-party billing. Also, not using the most current data that comes after we establish a preliminary levy. So in the time that's elapsed since the preliminary levy to today, we have come more in focus as to what 25 is gonna look like. So in the summer of 24, some of that stuff we're projecting based on past years. As Heidi's done that analysis now, we would be able to cover this position with these funds without third-party billing going forward. So that's also a positive position. I can't guarantee these dollars will be here forever, but they are part of the statute. They're baked into statute, and it's built into the state base budget. That's about as secure a funding as you can get from the state. That being said, things change, and we adapt to change every year.
Because administrations change on the state and the federal
Governors
level, and some of
change,
the federal money.
legislatures change, presidents change.
Well, the legislature could come in and revise that statute, couldn't they?
They could, but I would say that, you know, we've seen, there's some things that we'll get funding on that is not in the base budget. It's money that's been appropriated in a particular session, and there's no guarantee that it's gonna continue. There, it needs a lot of political support to be able to be sustainable. So the question we all had with these new dollars is it in the base budget? If it's in the base budget and and the allocation is in the statute, it's a lot harder to undo. Not impossible, but a lot harder. And I'd also note that the changes in public health that this is intended to support have a lot of bipartisan support. So it wouldn't have landed in statute, and it wouldn't have had the stability of funding that they're projecting if it didn't have a lot of bipartisan support.
In those statute points that you could look up, talks about community health a lot, the Community Joint Board of Health. So just explain the difference. This is money that's, isn't it directed to community health boards? Which we are one with Fillmore County, correct?
Correct.
So we're gonna hire a nurse and a community health worker. Fillmore County must have hired somebody, right?
They have, yes.
So that's one money coming to both counties?
All of our money, I shouldn't say all, but most of our money comes to the Community Health Board, which is Houston and Fillmore, because neither county exceeds
I know,
30,000.
I get that, yep.
So that money, the state looks at us as one,
Right.
but then remember that packet we go over all the time, which is our allocation methodology, based on population, based on different categories or different things that are part of how the money comes to the CHBs. So once it's cut at a state level to each of the CHBs, then we, as Fillmore Houston, cut it again based on whatever that methodology is that we've agreed on. Did that answer the question?
Yep. So, you know, getting back to what kind of Bob said about, you know, things can change. It's already changed for the cannabis funding.
It changed for cannabis in the last legislative session. I would say that the cannabis legislation is the least predictable at this time. And
That's an understatement.
true, right? During the last legislative session, a third of that money that was intended to go across to the different local public health entities was redirected somewhere else. I have heard that there will be a spirited defense of that at the next legislative session. Whether that has legs or not, I have no idea. But even at that reduction, we still are able to cover our cost. We projected pretty low on what we were intending to get from public, or from the cannabis.
So to get this money, we have to show what we are doing for this money, correct?
Correct.
We're applying, so what we do is we'll hire these people, start our program, do our programs and studies and to show proof of what we are doing to abide by the statute. And then they reimburse us monthly or,
Then I do the financial reporting
yeah, so you'll be doing the financial reporting monthly?
in the accounting unit.
Yep.
We do that.
Okay.
They stipulate whether it's monthly, quarterly, depending on the grant.
Yeah, I thought I read monthly, but maybe I was wrong.
Some
Well,
are monthly, some are
Quarterly, okay.
and then, yep. So the financial piece is done in the accounting unit.
And then we quarterly report on the where we're at with programming.
That was a question we had from last time too, was would we be reporting on this? And I answered poorly to that, or maybe didn't answer at all, but really any money we get, we have to report on, did you do what you were supposed to do with it? And that's done on a regular basis, quarterly, annually, sometimes monthly, both for did you spend the money on allowable things and did you do the things we asked you to do?
Yep.
So this isn't any different. It has the same level of reporting that we see with many of our programs.
That's also how we get the money.
Yeah,
Right, if you don't follow the rules and what you're using it for, you don't get the money.
right. Or if they don't like our reports and they come in and audit us and say, you spent it in the wrong place, then we have to make account for that as well. That hasn't happened under our watch and don't anticipate that it will, but just because we send in a report doesn't mean the state says, oh, good, we get audited as well.
So we're currently looking for a RN nurse position,
Correct.
right? This would be an additional one, correct?
Right, there's a current vacancy. This would be an additional RN, and it could be a RN that's on track to be a public health nurse, or, you know, in the last recruitment, we had a public health nurse who we made an offer to, and it didn't work out, so.
And the community educator or
Community health worker,
community health worker, that's a new position.
correct. We don't have that position, and
Will that person be helping, working with Bree? And I assume you too, or,
They have
And
a
with
lot of-
nurses.
Right, and with nurses. They have, this position would offer a lot of flexibility because we do wear a lot of hats in public health to cover all of the grants that we have. And a community health worker will be able to work in multiple of the grants. So it will be mostly the new funding, but we'll also be able to utilize whoever that person is too on multiple areas within public health.
the state won't necessarily say, you hired Jane Doe, show me that Jane Doe did these things. They'll want to know that we spent the money to do the things they asked, and they'll want to know that those things got done. And so, you know, we will use staffing as efficiently and effectively as we possibly can. This position, a community health worker, provides an opportunity to do some of this work with a lower paid individual that is more efficient, and also provides potentially a training ground, given recent history of difficulty recruiting and hiring public health positions. Being able to bring entry-level people into the agency to get their feet wet in public health, maybe they go back and get more education or whatever, they could potentially be some of the folks that we're trying to grow our own public health educators, public health nurses and the like. So that's part of the strategy as well. But also, you can get more done for less money if you have this person doing things that you don't need to be an RN or a public health nurse or a public health educator to do.
so the scenario for community health worker, when we start getting guidance from the state on cannabis education, her job will be to help do studies or measure
Correct.
work with, that Bree is doing to educate the public on cannabis? Or
We don't have the cannabis duty, I mean.
Not yet.
Right, but, Bree would be the charge person, or our health educator would be the charge person on cannabis.
Right.
But there are gonna be some topics in there that aren't gonna require Bree to be in charge of, where Bree's time could be spent elsewhere, such as FAP or RSG, that require our health educator.
Okay.
Those things would be, our community health worker can step in and do some of that, so, yes.
Okay.
But community health worker would be under the direction of me, or we're not putting supervisories, any level of that to our health educator, but they would work closely with our health educator, yes.
I guess the key for me is that the current budget does not include these two people. It also does not include the revenue from the grant that rolls forward. So if we do this, it's not a hit on the levy for the next 4 years that's anticipated. And we don't know what's gonna happen at the end of 4 years. You think it's part of the base, it might not be part of the base, it all depends on what happens with administrations and whatnot. So my only concern is what it means to the levy. So if we approve this on the basis of the 4-year rolling average, and then it's up to renewal at the end of the 4 years, if there's no revenue for it, the positions or one of the positions might have to be terminated.
I'd say correct to that, but I think the 4-year period you're talking about is what we know they will allow us to roll over.
Right.
It would still be in
I'm just
statute.
talking about givens.
Right.
You're
Right.
given the fact that that's gonna roll for 4 years.
They would need to pick it up and say, we want to revise the statute. Otherwise, they may say you can't roll over dollars anymore, but the statute stays the same, the funding stays the same. You just don't have that ability to roll over unused dollars. That's what will get evaluated in 4 years.
But if the funding leaves and then you expect the taxpayers of Houston County to pick up, that's where I'd have a problem with keeping them. So I'm okay with the two hires, and I'm okay knowing that for 4 years, it's not gonna have an effect on the levy. Maybe there's gonna be monies that you can charge against this to help build up the account as far as future carrying on with that person or persons. But if you lose the revenue, I mean, you just gotta put a limit someplace.
Right. If we lose the revenue and we don't have revenue from another place, we have to make adjustments. And
You'll have to budget it.
have to budget it. And you have to, if that means that we need to make adjustments to staffing, then so be it. But I think that would be a pretty seismic change where a lot of counties would be wrestling with those same types of things.
Sure.
And, you know, we will still apply third-party billing. And we can't build a balance in this, so to speak. The other thing to bear in mind is we have a required county cost share. And
I was just gonna ask that.
so, well, maybe right now with no third-party billing, we don't have a levy requirement. We can probably build better services to the people of Houston County by growing revenue through third-party billing. But we can't reduce, we're close to where we need to be with the county cost share, given the snapshot today in 2024. That can change with new funding or changes in old funding. We're looking at that county cost share all the time.
And the cost share is what, 70%?
For most of the public health programs, it's 10%. For the foundational public health, it's 75%. So we exceeded the county cost share and were able to meet that additional amount with the foundational public health responsibilities without making big changes.
The other aspect to this is if we don't approve this and we don't do that, then the money will go back to Fillmore County and they can hire more people. Or if they don't, it goes back to the state. Right?
Yeah, and I
It
wonder.
doesn't go back to the state, it just doesn't get sent down. I mean, it's,
Well, the state keeps it.
Well, yeah,
no, it's not a pool of money, it's something that you apply for.
right. I also
Or am I
want,
wrong on that, Jordan?
We don't apply for these, we're not applying for these, they come in as allocations, so
Yeah,
it's not
okay,
a,
it's allocated, so
Yep.
if we don't have two people hired, we won't get allocated for that.
I guess I'm not exactly sure how the state would do that.
You have to use it to earn it.
Right,
So, but the money's allocated to our CHB and then allocated again based on our allocation methodology. But you have to show an allowable cost to be able to get it. So if you choose not to do this and we're not able to do the work, obviously we wouldn't generate the revenue. And first, that would provide an opportunity for Fillmore County to increase their services, I guess at the expense of Houston County residents. But it also wouldn't preclude you from the requirements that are in the statute for you to do this work. So at some point, we would still have to submit reports saying, did we or didn't we do this? I don't know how that would roll. I haven't been in that kind of scenario. Typically, we try to meet the requirements the state gives us.
So Jordan, there's a need for this in our community.
there's a need for it in our community, and there's a need for it within the staffing to meet the need within the community, because we don't have enough staff to do these requirements right now.
Third-party billing, who's that? Who do you bill to?
Like health plans and
Okay,
Insurance company.
Okay.
There is a need, the funding is available, so that the levy does not get hit for the next 4 years. We anticipate the next 4 years as far as the rolling funding. That all said, because of the need, because of the statutes, I'll make a motion to approve the public health responsibility, FPR, HR responsibility, sustainable grant, RSG, and cannabis education funding increases to the hiring of the one full-time RN, PHN, and one full-time community health worker. That's a
Okay,
mouthful.
there's a motion. Is there a second to that?
Is there anything on there about the end of the funding with that motion?
Okay, we need a clarification that the advertisement is going to be for one FTE RN track nurse or one public health nurse. Because if you only get applications for an RN on the PHN track, you don't get any for the public health nurse. You know, it's just like it's been advertised now.
Correct. Yep.
we have advertised it both, so we have received both public health. Like I said, the last recruitment,
But there'd only be one hired. So
Only
it's gonna
one.
be an advertisement
Right.
that kind of shows two separate things,
but it's only one
but it's
person.
only for one hire.
Right.
Right. Right. Okay.
Because they're two different job classes. So if we've got a qualified public health nurse, we'll hire them.
I'll amend my motion to also note that at the end of the 4-year period, it's subject to funding review.
Okay.
I'll second it.
Okay, there's a second. Is there any further discussion?
Vote by roll.
We can vote by roll. I hesitate on the community health one, just because we don't know yet, but trusting that you guys know what that person's gonna be doing. I understand the health nurse one, I get that.
I go along with that, the health nurse.
So,
One comment to that.
go ahead.
Again, I understand it's a new position, but it's an attempt to be more economical. We could come to you with 2 RNs, because 1 RN isn't gonna be able to get all the work done. But instead, we wanted to come with a more economical approach, because there are things that our RNs and PHNs do that you don't have to necessarily be an RN or a PHN to do. And so those things, especially in this new funding, we can use a lower qualified person and also potentially establish career pathways in public health. That's what we're intending to do.
I understand that.
You're being as frugal as you can.
Yeah.
And there's a lot of community outreach too that we're hoping to do with these new funding pieces, and a community health worker, that is going to be their main focus too, so that's why we went that route. And you're gonna see, I think across the state, you'll see more community health workers coming up too. It's a newer position. There's quite a few counties that are bringing community health workers on, so.
Well, I've done a lot of research and looking into this and listened to you guys, so you've convinced me. I do worry about the change of funding. You know, legislatures can change things in a dime. I guess we'll have to deal with it at that time. I just hope we can find somebody, hire somebody.
Yeah.
Because we're already.
As do we.
We've been looking for a nurse for some time now, so. Well, you wanna do a roll call, or
Just call it.
all those in favor signify by saying aye?
Aye.
Opposed, same sign. All right. Good luck. Now, we can go on to the next one, number 8.
We're up again.
Consider preliminary plans and cost estimates for community services center renovation utilizing available grant funding.
So this is what we talked about at your work session. Essentially what it is just getting your approval to go forward with CDG to develop construction documents so we can start the bidding process. In the end, you get to decide whether you approve bids or not, but that's the next step for us to keep this process rolling. If you recall, these dollars have a fuse, and so the sooner we're able to implement this and get rolling, the better, so that we don't risk losing those dollars. It's also a relational thing between you guys and Fillmore, because they're more than willing to use these dollars if we are unable or unwilling to. So to a few of their county commissioners and to the public health director, we've talked about the planning that we've had in place. I believe this will be a significant improvement to our public health facility and also position us to do a better job of mass dispensing and also some of our newer programs like dental access. I think it will vastly improve access in those areas. So that's what this is to approve going forward with CDG to begin construction documents and begin the bidding process. Lastly, our hope is to try and have this kind of out there for bid during kind of the off-season in construction, hoping that we get a little more favorable bids.
So you touched on how this is gonna improve our community outreach, doing our building. Like the dental part, can you get more specific on that?
So if you were in our office during a dental clinic, it's really, really tight.
Okay,
In fact, I think Jordan has said that when they get the portable dental chair in there, they can fit the person in the dental chair and the dentist and maybe an assistant in there. But say you've got a child and parents out in the waiting room. Very, very tight. They've been very accommodating, and we've served a lot of people that way, but that would be an improvement. Also, our surfaces and kind of just the clinical spaces are aged, and having medical grade surfaces and things to support the kinds of clinic things that we're doing with immunizations, with dental clinics, with foot clinics, different things like that that we're committed to. And then, of course, hopefully there's no need for mass dispensing like we saw it with COVID, but it would accommodate that type of an event better than what we had during the pandemic. We were very fortunate to work with Four Seasons, and that was a facility that worked really well for us, but we had to work around scheduling and could only do that at certain dates. And there was very little capacity for us to do those types of immunizations in our facility. This would accommodate being able to continue doing that should the need arise. I don't know, do you have other things you want to add to that?
And that's about it. We are doing a dental day today, so if you wanted to come take a look at how tight it is, you're more than welcome to come down to the building.
But you can't sit in the dental clinic.
You can't, unless you have an appointment.
So you'll be a bigger room for the dental.
Yes, because it's, right now it's marked
And
as our.
immunizations and dental. It'll be
Correct.
a,
Yep, yep.
Really what it is reconfiguring the space at the front of the building. A lot of that space is poorly used for current need. And so it also improves the sight line for a person working the front desk. Right now, they come in and they go on the other side of the vestibule, and the person at the front desk can't see people waiting. So it improves some of that safety and different things like that.
And it puts
Also
secure
secure
points.
access points. We deal with federal tax information, and so each year we have to tell them what our strategy is to protect that. That's one of our weakest points, is that building.
you're still gonna be limited on for vaccinations though, I mean, as far as masks.
Yeah, we're not gonna-
I mean, you're still gonna have to, like last time we go at the community center.
Absolutely. If we're doing an event like, or a situation like that, we would not be able to accommodate what we did at Four Seasons by doing this. What we'd be able to do is have better daily vaccines so that people wouldn't have to wait for those big events.
Had someone ask me, we don't do COVID vaccinations anymore.
No.
Would we start that with this or not?
The
Because the numbers are so few that,
Yeah, and I think it would need to be kind of a change in, say, a dramatic uptick in COVID cases or something else where we would get deep into that again.
where the other providers are being able to keep up.
Right, other providers like your pharmacies, your primary care providers are keeping up with that. We still do immunizations, but not obviously like we did during the pandemic. And we were unique in that we were able to get vaccine before anybody else was. And I mean, again, I would say it was really an amazing experience, one of the coolest things I've been involved in. We led the state in immunization rates at the beginning of the pandemic. And great work on the part of our staff, and also a legion of volunteers who helped make that happen. And, in a situation like that, again, obviously this renovation isn't gonna give you the tools you need to get it all done there. But it would be one more tool in the box that would have helped us.
So everything in the blue is staying the same, correct?
Correct.
Just the white areas that are being renovated?
Yes.
I guess the request here is just to approve going a little bit further and getting cost estimates and the design and so on, so.
It'll be
Another
getting
check and
bids,
balance.
right?
Well,
Or not?
We worked with CDG to get this design set up, but now if we're gonna continue, we need to have them do construction documents.
Okay.
I will say that construction and all of that is not something that I have a deep skill set in. We're working with Brian, and prior to that, we worked with Tess on this project. And, obviously, we've worked with the Minnesota Department of Health, who's approved our plans, as well as now these preliminary design plans. But this would be working with CDG to come up with construction documents that we can then put out to bid, and then we'd be coming back to you with bids.
So how much money do you have to operate with?
About 330,000,
Yep.
330,
$331,000.
It's come in higher, it's off the table, or?
well, I don't know that we'd get rid of all of it, but we would need to make adjustments.
This is ARPA money, correct? Or is it
No, it's
COVID, so it's
vaccine.
COVID?
There's two funding pots. One's COVID vaccine and one's, ELC, so upgrading laboratory and all that. So that one's a little bit more flexible than the immunization funds, but it all fits into the pot, so. And they're aware of
But it
it.
is federal funds, right?
All federal.
It's kind of an interesting history on it. We stood up the immunization clinics and did all of that, and the money we had to do that from the state ran out. We ended up using ARPA to cover a lot of the overage, and then we got this big grant from the feds for immunization, but we were pretty much done. Unfortunately, we couldn't go back and say, okay, can we go back and cover those things that we did? And so a number of counties have used this to be able to improve their capacity to do public health services and immunization and things like that.
So by moving forward with this, that means that we're pretty much committing to the community health service building out there along the highway for the long haul future, I would say, don't you think?
I would say you're right. But by moving forward, first we find out what it's gonna cost.
Tried that with this place.
Well, it's gotta stay under the,
Yeah,
dollar amount. But this should put the rest of the rumors of selling that out there. I mean, it's gonna be,
Yeah.
it's gonna
done.
be utilized by the county, right? So.
There's a couple more checks and balances between now and the project. First of all, when we see the design, second of all, when we see the bids and the bids are decided if over, then it gets dropped, so.
Yep, yep.
I think we need to get some information, and the only way to get the information is to approve this, so I move to authorize the preliminary plans and cost estimates.
For the community service center renovation. Is there a second to that?
I'll second it.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Thank you.
Thank you.
Number 9, consider approving 2025 board meeting schedule. Allison, you got that put together for us? Is there anybody have any issues on the dates on that, or?
not me.
I'm sure you, Dewey and Bob won't have any.
In December, don't we usually have a meeting on the last, even though it's the 5th week because they're off for,
The 30th?
We do this year, right?
Yes, we could add that in there if we
Well, because
need it.
we will have 3 meetings.
Yeah.
the year to have possibly a wrap.
Second?
It would be nice
Yeah,
to
we
have
can
that.
make that change. I think I was just looking at, I wasn't
Because it was the
remembering
fifth,
that,
yeah.
yeah.
So we'll add,
24 you're talking about, this is 25.
Right, it's 25.
Yeah,
but
25.
24 we'll have-
24 is in here already.
This is for the 25 schedule.
Yeah.
So we could add that in there, the December
Yep, you could
30th.
approve it with that change and I'll make
Okay.
that change and then get it on the website.
Can you email us all?
A
Email
copy of it, yes, I will send you all a copy of it too.
Maybe not all.
I guess you wouldn't have to send Bob a Dewey.
So is there a motion to approve the 2025 meeting schedule with the addition of December 30th?
Motion to approve with that addition.
Second.
Motion's been made and seconded. Any further discussion?
Should I abstain?
No, you can vote for this. You're still commissioner.
we can still make more dates for you too.
Oh,
All those in favor signify by saying aye.
Aye.
Opposed, same sign. Okay. Number 10, discuss the and possible take action regarding office staffing, hiring, job descriptions, and the Freeborn County Assessor's Assistance request. Carol.
A lot of stuff.
Had a number of things that we didn't necessarily have specifics on, time of the agenda. But, first off, we have the auditor's office. Hold up. We advertised for a full-time position. Because we have 2 full-time and 1 half-time in the auditor's office and the license center. We didn't get any applicants. And now the person who went full-time would request to go back to half-time. So what do we need to advertise now to get your staff to full level?
At this point, I'm thinking two full.
Okay, it'd be 2 full-time.
2 full and a half, or
No.
just 2 full?
2 full.
Okay.
Okay.
Because Ella's leaving shortly, right?
She
did.
gone.
She's already gone, okay.
She did.
Yeah,
And that position was advertised and we didn't get any applicants.
okay.
We hire two, one goes to auditor, one goes to the license center?
Well, it's all the
You're
same.
gonna just kind of.
Well, it's all the same, but it still would be better to have more of a primary focus for an employee, so they're not shifted around. It's hard to go from the license center to the auditor. You know, you have the certifications that you have to have for that, and, you know,
Okay, so then the 2 full-time will be one for,
One for the license center, one
Okay.
for the auditor treasurer. The person that would go to halftime, back to halftime, would kind of be the fill-ins for the license center. Lunch breaks and sick days, whatever, but would also be available to help with backup on, like Amy's job with documents and warrants, printing warrants and snowmobile, just different duties, license.
so we're gonna try a different approach and have it more specific.
right.
When you advertise, you're gonna have more.
In advertising, it will be more of a focus, you know, for the specific areas, just to make it better for,
What's the hit on the budget? What would the hit on the budget be? Anything?
no,
Already
there
budgeted.
wouldn't be anything. It's already budgeted,
Anything.
it's just in different spots.
The two positions we're talking about are the two that are empty then? Plus the
Well,
halftime.
one of them is filled kind of half-time now, but she'll be going back to that. So there'll be 2 open full-time positions, and they've all
Already
been
in the- Already
budgeted.
in the budget.
They're already budgeted.
That's fine.
This is information, I don't need action on this, is that what you're saying?
I think we should probably have action. Let's have action to advertise them as focused positions.
Okay, is there a motion to advertise for the focus positions in the auditor's office?
So moved.
Oh, that wasn't,
Good motion, what,
No.
you asked for a motion?
I'm asking for, so you,
I asked if we needed action, and she commented she needed action, right?
So you're motioning to approve the hiring of 2 people, full-time, one for the license office and one for the auditor's office.
Correct.
Yep.
Without a hit to the budget.
I'll make that a motion. Dewey seconded it.
Okay.
I don't like to make motions as a chairman, whatever.
Did you get that email?
That you are entitled.
But we don't know when.
Okay.
Any further discussion on that?
We'll bring back the exact date when current full-time employee goes to halftime.
Okay.
Okay.
All those in favor signify by saying aye.
Aye.
Opposed, same sign. What else you got?
Oh, well, we're just. So here's the Human Resources Director / job description, and I've just gone through and taken out all of the,
Got another copy.
all of the references to the county attorney contract work and the facilities maintenance.
Yep.
And making that human resources officer instead of director and being under the county administrators.
Yep.
Creating that umbrella as opposed to having two separate offices.
Yep.
So I'd like to have that approved so that we can advertise for it.
You're not requiring them to have any law experience? I just saw that crossed out there, but,
No, they don't need a Juris Doctorate in law.
okay.
That was, yeah, that was more of a contract work thing.
Basically, the things that are lined out there, like page 2, facilities management, are all lined out, so those are removed. So if it's not lined out, it's still in there. I had the opportunity to get this yesterday.
Well, I'll make a motion to go ahead and start to pursue a HR. I looked at this all
With the
yesterday.
updated job description?
Yep.
Should we get rebanded? Should have it sent in for the.
Seen this at the personnel yesterday.
I'll second it.
Motion been made and seconded. Any further discussion?
I kind of would have liked it. You guys saw it yesterday. This is the first I've seen it. It's a little hard to vote in favor of something I haven't had a chance to read.
Oh, I gave it.
Well, we've had discussions where we're not gonna,
Understand.
require them to have, cover the facilities and do contract work.
The language isn't changing other than what's crossed out.
Correct.
Is there any more you'd like to add, Carol, or? No?
No, just that we'd like to get it advertised and
Yep. Okay, motion's been made and seconded. No further discussion. If not, is there, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Okay, what else you got?
all right, then, I've been reviewing, there was an approved job description for an environmental services tech clerk / assessor's office. And at the stage that we're at right now with environmental services, we need to have the full-time position in that office. And we'll look down the road to see, where we need to supplement the other offices with probably some support staff. So this is the Environmental Services Office Technical Clerk 1 description that had been in place previously. So I would like to have that job description approved and approval to advertise for it.
Okay.
It just seems like a good time for them to have the total assistance in that office.
So that means that, yeah, that's all budgeted, right? Wasn't that position budgeted as well
Yes.
I believe so.
for 2025?
Yes. Amelia did go through the job description and just to make sure there was some redundancy in a couple of things that she got changed and worked out.
So is there a motion to approval of the job description for a personal tech in planning and zoning and go forward with the advertising thereof?
So far, go for it. I make a motion.
Is there a second to that?
I'll second it.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Okay.
Okay, and Luke is here. Come up. We've been contacted by Freeborn County to provide some assistance for them. She did send a copy of a contract, but it was an independent contractor's agreement with Luke, rather than a contract with the county, which, Freeborn County's former auditor treasurer left and they contracted with her like Winona County, their assessor left, so they contracted with a person, but they're asking to contract with us, but they have the contract made out in him, which isn't necessarily what he would be interested in.
He's a
Doing.
Houston County employee, he's not an independent contractor.
Right,
Right. I'm not really comfortable with that, that
Mhm.
I'm contracting with them. I'd rather they are contracting with you guys. I did talk to her. She's going to send over
okay.
a new one.
A new one.
And she did say that she would really like 2 days a week. And I asked for how long, and I didn't get an answer back on that. I honestly don't know if I could do 2 days a week and still keep up here, to be honest. So it's already gonna be a lot of extra nights and weekend stuff, so I don't know that I could do 2 days there, not in person anyway. I mean, I could be available and be here for phone calls and Zoom stuff maybe, but in person 2 days, we would get behind here, and here's my number one priority, so. Trying to help to be nice.
So we'll get a copy of the new contract that she sends and send it
Yeah.
out to you, and I guess knowing what you do, that we probably couldn't agree to 2 days a week, that he actually be there physically if they,
If we have a chance to make any of your changes before it gets to us, then just to, so you
Yeah,
get
I
your
mean, I
input.
could, I told her I would email her back after this, and I could just say, you know,
What he.
it's whatever you guys.
Well, it's what you feel you can do. I mean, if you can only do 1 day a week, I would just say that up front. And
Right.
they'd have to say
Yeah, I
nay or
just-
nay.
Cause I went up there last week, one day in the afternoon, just to kind of see where they were at. And they have a big problem, whereas, I mean, I think it's gonna be more than I'm gonna be able to help with in one day a week, but at least I can keep them afloat, I think. Feel bad for the new person coming in, but where they're at 2 days a week, I would be swamped, not, and I'm just afraid I'd get behind here, and I do not wanna do that. So, I mean, I wanna help, but there's a limit to what I can do.
So your duty there would be to review and sign or whatever you need to do as your license, your
Yep, and kinda,
position.
they want me to come up with kinda like a plan and training. None of their staff is really trained on how to run the system, how to do anything. So when I was up there, I just kinda sat with them, and, I mean, their questions are things that, you know, they've been there 2 years, they should have known within the first couple months. So they're,
Way behind.
like 700 parcels behind in new construction. And so it's kind of like what we were here when I came in. But, so I did get them, they're going to contract Vanguard to come in and do the new construction and the commercial appraisals that they're behind on. And so basically I'll be teaching staff and then, yeah, signing off on assessor type things. So they would technically I would be an interim assessor, so I can sign those things, but I would not be their assessor, I guess is how I understand it.
They're in the process of advertising for an assessor, or do they have?
Yep, it's posted. I saw they posted it this week, so it is posted, so.
I looked at it last week.
It was there last week too? Okay.
And
It ends December 4th, but that's to say they
Yeah,
get
I mean,
applicants.
I-
So how would the Department of Revenue look at, I mean, you're our assessor and you're their interim assessor, you can.
Yeah, so
That would work
I
okay?
talked to them, they're okay with it. They're already 30 days in, so it would only be 60 days, and then they would have to ask for a extension. I guess right now I would maybe just wanna limit it to the 60 days, cause if it gets beyond that, it's just gonna be too much. I mean, cause when we get into 60 days, that's when, you know, right now, I'm setting numbers and doing stuff like that, and they're out doing new construction, but once we get into the new year, then it's transferring values and doing phone calls and all that, then I won't have time to be there, there's no way. So, I mean, the 60 days, I think, would be kind of the limit as far as I would be comfortable with.
So they're hiring Vanguard to do certain things. Cannot Vanguard do all of it?
They can't do the assessor stuff. You have to be licensed on that, and they're gonna do some of the training too, I think. So they were supposed to get that set up, because I talked to Vanguard a couple weeks ago and just suggested that they talk to them about doing that, and they did hire them, so that'll help too. But I guess I'm fine with whatever you guys decide. I just,
Isn't it kind of up to you though? I mean,
yeah, I mean, but, you know, I'm willing to help, but I don't think more than 1 day a week and not more than 60 days. 'Cause it'll start to interfere here. Not willing to do that.
Get a contract with that all in it, I suppose, and we can look at that.
It's up to him, but he's asking the county's blessing to do this, so.
Basically, yeah. And I want the contract to be through you guys and not.
Yeah, not as an independent contractor.
Yeah,
We don't have that in our hands yet, that.
not yet, no.
So maybe
Well,
that
she
should-
sent over one, but that was with, basically, I'm the independent contractor, and I don't want, I want you guys to be able to say, nope, it's done, and not, you know.
So when they send you the new one, share that with us and we'll discuss it for action next week.
Okay.
How the timeline work, okay?
Is that okay with you guys?
Yep, what?
If you're paying attention, you do. You're gonna send us the new contract for us to review it, for us to consider next week for approval.
Do you know, Luke, is there any verbiage in there about like for travel, for reimbursement to the county for expenses?
That's what we'll work through before
Yeah.
we
Bob
send it
had
to
a
you.
little sidebar there. but-
Yeah, cause I brought that up to her today, you know, it's not just the hours during the day. I
Right.
said, you know, it takes me almost 3 hours to get there. It's like 2 hours and
Just
40
putting a
some
pretty big
minutes.
load on you that way.
You know, and so, you know, if I take my own vehicle, that's fine, and they pay me back, you know, I don't know that I wanna take a county vehicle up there, but unless they're gonna pay the county,
Yeah, that's what
you
we're
know.
It's a county,
inquiring about.
you know, your
Yeah, it's a
contract
county
is with the
contract,
contract.
you know, but they'd have to pay fuel.
Oh, you
and
gotta
then
work that stuff out.
mileage, and then
That's-
plus some kind of maintenance.
Those are the details you have to work out.
Yeah, we'll have to see what they have in the contract,
Yep.
and then we'll
Add
Go from
if
there.
you need to.
Yeah, add and subtract.
Yo,
add.
Okay,
So, all right,
good enough.
all right, thank you.
Thank you. That's it, Carol?
I think for now, yeah.
Yep, okay. Consider reviewing, number 11, consider reviewing and approving payments. Everybody's looked at the payment schedule here. Any
move to
questions?
approve.
Motion been made to approve. Is there a second?
Second.
Any further discussion? If not, all those in favor signify by saying aye.
I,
Opposed, same sign. Before we go to closed session, maybe we should go into discussion items. Have administrator updates. Kinda did that all. Okay. Only thing I had to bring up was one of the things I had to bring up, the cannabis. Sam sent that out yesterday, the new cannabis. Everybody had a chance to look at that.
working on it.
It's something that we need to. Amelia, would you want to come forward with that, please? So is this something we're gonna have to agree to approve at our next board meeting to advertise for a public hearing?
It didn't sound like we needed a formal approval to go to advertise for a public hearing. I guess I just look for guidance from you guys on when you'd like to do that.
Well, we're gonna have to advertise for a public hearing,
We will.
but we won't have to approve this at a regular meeting to advertise for a public meeting or
No.
to approve what the draft is. The only thing, I talked to Amelia about this morning, the subject of the counties. It's not mentioned in there, and she explained why, but the 1 per 12.5, we just got in there that we're gonna allow 4 in the county. under the county ordinance. That's what we discussed at our workshop, is that right?
Correct.
Was it 4 or 6?
4.
Like 6 and we kind of agreed to 4.
No, it's 4 for anybody that's following the county ordinance.
Right.
If it's a city gonna do their own thing, they can have
There,
many as they want, I guess, but.
But until they have their own thing, they're subject to the county.
I'm stuck on the 2 myself. Why the 4? I think every other county is doing the 1 per 12.5 rule, which for us would be 2.
That's a minimum though.
That's the minimum.
That's right. And most of the counties are doing just the minimum to start out with. I think we should too. Instead of the 4, giving the fact that some cities are gonna do their own thing. What do you guys think of that?
So you wanna have 2, and then if, let's say Houston decides to have 1, then they have to do their own ordinance and.
their own ordinance.
No. Other cities, other locations can do, follow our ordinance.
They would be under.
Our ordinance is gonna say 2 instead of, so, yeah, first come, first serve. If
I remember we kind of said that there were basically 4 communities that weren't doing their own. So that's how we came up with the number 4. We started out a little bit talking about 6, and then somebody brought up that there was Eitzen, Holka, Brownsville, et cetera, and we came up with our 4. I think that's where we came up with the 4 for the sample ordinance. That's what I remember.
That's kinda what I would remember.
I'm happy with the 4.
Especially with knowing that these cities are having their own numbers, like Caledonia
Bigger
and
ones,
Crescent,
correct.
they have their own
And that doesn't-
ordinance and their own limit, I guess.
That doesn't mean that 4 will survive down the road if the bigger
point.
communities have that. But it does give ample opportunities for each of them to have one inside their community under our ordinance.
If, okay, assuming the 4, and we put our ordinance in place, Caledonia doesn't have one yet, and we give out all 4, 2 in Caledonia, 1 in Houston, 1 in someplace else, and Caledonia comes up with their own ordinance, do we get that? Do we get the 2 back that they were using? So that we go back up to having 4 available?
I would say yes. I'm not exactly sure how that formal process would take place, but yes.
Right. Just that Caledonia likely won't have one available, won't be done with it before the first of the year, depends on when they get done with it. If we get ours in place, they're subject to our ordinance until they come up, if they come up with their own. Same thing for La Crescent. I'm assuming La Crescent must be farther along than,
They're looking at December as making their final vote, I understand.
and when we have the public hearing, this is an issue that's gonna come up for discussion. I assume.
Probably.
Okay,
So the public hearing first would be to us or to the planning commission?
to us.
Okay, yeah, because you already discussed this in the planning phase.
We took the very preliminary draft to the planning commission and got a little bit of feedback from them. But at this point, we weren't planning to take it back to them, so it would just be in front of you guys.
Okay.
So you could advertise for this right away then?
Yeah, if you'd like to, would you like to host like the public hearing on the 17th and then look at the, or adopt the final draft potentially the end of December?
That'd be
Or do you
fine.
want to do them all in the same meeting?
No,
And I should mention Sam is out of the office during the middle of December, so he would be unavailable for that 17th.
he's not, he won't be available for the 17th? When will he be?
The 31st. And we're too late for the 3rd at this
Well,
point.
we'd like to have them there for the public hearing. Can we have it sooner then, or are we,
Gotta advertise certain
We-
period of time.
We have 10 days from now.
if you advertised it tomorrow? You gotta have 10 days advertising for a public hearing, right?
It would end up in that you guys are out of town at that conference, correct?
So we
So
won't
that,
get, we
that's
won't be
kind of
able,
what throws the wrench in the plan.
I would think so.
No, we're on it, it's the,
And
third is our first December meeting.
So who's our interim?
Sue.
Sue,
Is she available
you
then?
available?
I could check on that.
Well, if we advertise this tomorrow, this has gotta be 10 working days? Allison, do you remember that? Does it?
this is.
Well, and with the
This
paper
day?
schedule, it ends up being a couple weeks anyway. So tomorrow would put us
Oh, yeah.
at the, I
That's
don't think
next
we'd make
week's
the
paper.
We're
3rd.
not gonna make the 3rd.
Well, we don't have a meeting in the first week in December because you gotta go to cities, correct? On the 9th.
Sunday, Monday, Tuesday.
We have a meeting the 3rd,
Yeah.
and then our normal work group session is when you guys are gone. Second week.
So we could tentatively plan for the 17th if Sue's available and comfortable to sit in on it, if you guys want to do that.
During our
Or
regular,
just
We don't
during
have,
our regular,
we don't have-
otherwise, I guess we could potentially host a public hearing at any point.
Yep.
It doesn't have to necessarily be during your board meetings.
So we will have a meeting the first week in December, correct?
Shoot for the 17th, if that
There's
doesn't.
a
You-
board meeting
you
the first
do.
week of December, but we're not gonna
so we won't be able to have the public hearing for it.
Or do you want us,
Do not have to have the public hearing on a Tuesday.
No, I was just gonna say, we could schedule this, I just don't know what Sam's schedule is. Sorry,
the 12th, the 20th, I believe he said he was out?
12th through the 20th?
You just watch it when it gets back. Before you make your decision.
Or if you'd like to just have it at the planning commission level in December, to have your public hearing on that Thursday evening, we could do that, and
Well,
then you
we're still gonna have
just,
to have a public hearing for the
for us.
county board meeting too.
no, you just have to have one. And then it would go on your action items.
So we could have it at the planning commission on the 24th or next in December, or are you talking November?
It would be,
24th is your
it would be in December.
December.
The 19th of December.
Planning commission could pass it and then it
Are we having a meeting on the 24th of December?
might have to have one.
Christmas Eve might not work out too well as far as a board meeting.
And I don't know how big of a deal it is to push it into January. If you were to look at it that first weekend, or first January. I mean, Sam will be gone at that point. And he's
I'd like to
been,
be able to get this done before I'm gone,
oh, yes, that's true.
myself. Bring in 2 new county board members.
That's
Oh,
true.
I agree, I think we should get this done before you guys go, so. We'll just have to do it without Sam being here.
If we get Sue and set a date and go from there.
So plan to host our public hearing on the 17th. Would you like it on the agenda for approval that day as well, or wait until the 31st?
Wait until the 31st.
Okay. That works.
31st Tuesday?
Yep,
It's Christmas Eve or New Year's Eve.
It ain't gonna matter, we're gonna get hooked.
I don't care. I mean, we have a meeting scheduled the 31st, correct?
For this year, yes.
But remember that we have to have the budget. Carol, is that the 28th of December? So we have to have it approved, the final budget? And if we don't have a meeting on the 24th, we have to approve the final budget on the 17th.
Do we have a meeting on the 24th?
We can't. I thought it was the 28th that we had to have it approved.
Used to have it in there, I guess I don't.
I don't have a schedule in front of me either.
There isn't one on the 24th.
There isn't?
Is that what you're looking for?
Yep. Okay.
The 3rd, 17th, and 31st.
Well, advertise for a public hearing on the 17th and
We can be
At our regular meeting, as part of our regular meeting?
unless
On the
you guys,
morning?
unless you guys want to do it in the evening or some other date, but that's what I was thinking.
I would like to see Sam or Sue in attendance, so I'd like
You'd
to
still-
work around their schedule myself, so.
Yeah, and actually I'm unavailable the 17th too, so, now that
You're not gonna be here either?
I have some training.
Oh, shit, this ain't gonna work.
But I guess I figured I was not an active part of,
Well, you're
The writing
a lot
of this,
information. Oofta.
I'm fine with an evening, get them available.
Whenever it works. This is the 19th of November. Can we just go out to 10 or 11 days and have an evening public hearing?
yeah. So what are you guys,
But it won't be advertised till next week's paper, right?
Or
In that
whatever
week-
date that works out.
Whatever.
that week of AMC, what dates are you guys actually gone?
Get back,
Monday, Tuesday. Right?
Sunday,
gotta
Monday,
do it on
Tuesday, Wednesday.
Come back Wednesday.
Come back the 11th.
And then everybody would be available
After that.
that Thursday potentially during the day? Or would you prefer an evening?
I think the public would prefer an evening,
I
but
think the public,
So would you want to do it on the at the evening on the 12th
on the 11th,
or the 11th?
that way we get our 10 days in and before Sam leaves.
Yeah, I can check on that. At 5 PM or 6 PM?
6, Bob?
that's,
6 is probably better if you're looking for public input.
I'm good either one of those, so.
The more the merrier.
Yeah,
6 o'clock on the 11th,
Okay,
The 11th.
be a full day.
then Sam can be there and you can be there. And Allison will be there. Well, you could do that.
can do it too, I don't care, I'm just asking.
I'll be there
If you
anyway,
could be
so.
there, Allison, that'd be good. But if you can't, Amelia could do it as well, right? John, would that work for you?
I'll be there on the 11th.
Okay. Clerk? No, just be there. Yeah, or yeah. Unless you want a clerk, you could do that.
Well, I might goof that up.
Okay. Well, let's shoot for that. Is that satisfactory to everybody else?
yep.
It's our meeting.
Okay,
It's not a planning commission, it's just a regular.
Nope, that would
hearing.
be for you guys, just you guys.
just for the
Cannabis
county
hearing.
board. Special hearing, yep. All right,
Sounds good, thank you.
thank you.
Thank you.
All right.
6 PM.
Go to commissioner reports. Dewey, you got anything?
No, personnel has been meeting with some unions. We're gonna have that during our closed session discussion. That's about the extent of it.
Okay,
I have a question here on this thing from Alameda County, isn't it? What's this about?
Bob can talk some more about that.
Me?
Commissioner Burns, you brought that in, right?
I did not, but
Oh,
this is the agreement that Alameda County has with the Historical Society for the use of their courthouse, the old courthouse.
Okay.
And the agreement that they've got for that as a template for us if we're gonna have an agreement with our
Oh, okay.
historical
to
society.
lease
Explains
the
it.
historic jail
Yeah.
to the historical society?
If that's the deal.
Rich Cordis dropped that off.
Oh, okay, I'm sorry.
All right, thank you.
they're still looking at it.
All right, that's it.
Commissioner Burns?
Well, I did a phone meeting that I was late for the child court committee, then Allison can talk about that. I went to the City of Caledonia marijuana meeting that they had last night, and they're working on their ordinance, but they have got a ways to go, and they don't think they'll have it ready before the end of the year. So I told them, if you don't have it and we have ours, you're subject to the county's ordinance until you get your own. Bluff Country HRA had a meeting yesterday, and they're in good shape financially. The monies have been allocated as far as home loans and home improvement funds. That's the $200,000 that we got by putting $20,000 each county into the HRA. And all the different facilities that the HRA has in Houston, Fillmore, and Mower County are doing well and all meeting all the criteria. After today, we got the community health meeting at 1. That's online, I guess.
Next week.
Next week.
It's not today?
Nope.
Oh, cool.
Next,
I got it on the wrong day.
next Tuesday, the 26th, correct, John?
Well, look at that, I gotta
3 p.m. today.
gotta make an arrow. Okay. But we have the opioid meeting at 3, right, today? Okay, and then I got Selco tonight at 5.
So you brought up a couple weeks ago about Bluff Country doing a donation, an appropriation of $3,000.
Yep. It's in the budget right now.
And we haven't done that since 2019, I believe.
That's right, yep.
What's the reason for putting that back in? Semcat's got a lot of money from all the COVID and state and,
Semcac and COVID.
I should say HRA, whatever.
Yeah. But their funding for certain aspects they don't have as much money for certain improvements and things that they do. So they're asking the county for $3,000 to help as far as the low-income projects that aren't acquisition of housing and whatnot.
Do they have any low-income projects in Houston County?
Mhm. The report was, like on the loans for houses, there's 3 in Houston County and 4 in Fillmore County as it stands right now, with 2 more loan applications coming. As far as the low-income senior housing that they've got, that's all funded federally. But they've got other small projects, things that they do, that the funding isn't adequate for what they should be getting done.
Is Fillmore County adding or donating 3,000 too?
That was gonna come before their board, and I don't know if they've approved it or not. I just told them that it's currently included in our budget.
Cause I know when that got taken away, we were the only ones doing that at that time in 2019, so. And the Selco thing, where are we at with them on negotiating a contract?
There's 1 more year left in there.
Oh, there's 1 more year? Okay.
That was a 3-year contract, that'll be up next year.
All right, so that's taken care of for 2025. All right. Commissioner Schultz.
Good, thank you. Covered everything.
Good, thank you. That's a report there.
Oh, we talked about this last week a little bit, but, Land Use Committee, we meet every, second Tuesday every morning at 8:00, 8:05, whatever. It was discussed, brought up that maybe trying to have a second one, have 2 a month, because we cover a lot of stuff, we run out of time. And I guess, to me, I guess it wouldn't be a problem, because I'm already on that committee, but, we'll discuss it at our next board meeting, but to having 2 per month, like maybe the second and the fourth Tuesdays.
Of course, we can talk more about it when we get our new recruits too.
Right. I just wanted to bring it up.
Good idea.
meeting here, so.
There's more than you can get done in one meeting. You almost have to have two.
Nothing else, Bob?
No, I'm good, thanks.
Greg, you got something?
I got a new pair of glasses. My wife said I couldn't read, so she got me a new pair of glasses.
That's good.
Outside of that, I got nothing much, but we closed doors, I guess. That's what I can't say nothing, so I'm good.
Okay. All right, that'll be our next item here is to, make a motion. Is there a motion to go?
Can I ask you a
Oh.
question? You want to do the, if there's other people here.
Yeah, is there a public comment? Anybody want to do a closing public comment?
No, no, okay.
I have one reminder, we're gonna have an early packet deadline, noon, Wednesday of next week, the week of Thanksgiving.
Okay, yep. So Wednesday is the deadline for next week's packet. All right. Okay, now can we, have a motion to go into closed session?
So moved.
Second.
Isn't that pursuant to?
Pursuant
such and
to
such?
Minnesota statute 13D03 to discuss labor negotiations, including labor negotiation strategies and developments and discussion and review.
Yep, I will mute her.
All those in favor signify by saying aye.
Aye.
Opposed, same sign.
And I am muting the telephone.
Dewey made a motion to come out of closed session at 12:13. Greg seconded it. And so we have a tentative agreement with ASME Local 2166. Do we have a motion to approve that tentative agreement?
With the information provided, I move to accept that agreement.
Second.
Motion's been made and seconded. Any more discussion on that? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. All right.
Just to note, no other action was taken on any of the other union
Right.
presentations.
Yep.
Oh, yeah, I have something. Amelia came back, I should.
Emilia, you want to bring something up or?
Or did you address it yet?
No, I just said you were gonna come back and.
Oh, we got looking at dates and our notes, and I know we discussed the 11th, but I thought we were discussing Thursday, and the 11th is actually Wednesday evening. So I just want to confirm, are we looking at Wednesday, the 11th?
Yes.
6?
Yes.
Okay,
Because,
because Sam will be actually gone the next day, so I just want to make sure that I had that right.
But that's why, because Sam's gonna be gone the next day, so that's, isn't that why we
So-
looked at it?
And I wasn't able to touch base with him to make sure that that worked, but I will.
let's see if hopefully that'll work.
Good luck.
All right, that's
All
all.
right. Thank you.
Thanks.
Oh, thanks.
Are you gonna be in this afternoon? No?
Yes. Depends what you're looking for.
I just wanted a couple of questions with regard to the cannabis. I've got the 3 o'clock meeting for opioids, so
Okay,
just before, or just after, I'll stop and talk to you.
okay. I should be around somewhere.
If you're not here, I'll understand.
All right. Anything else needs to come before the board?
Yeah, what are we gonna do about hiring an attorney?
We haven't got that far as appointing an interim to fill out the position yet.
Okay. Just kinda wonder what our plans are.
That'll be coming up. We did put out an advertisement for a
Assistant?
assistant county attorney. Yep,
Do we? Okay.
yep. All right. Anything else? If not, is there a motion to adjourn?
Oh,
Second.
All those in favor signify by saying aye.
Aye.
Opposed, same sign. Meeting adjourned.